Let's talk a little bit about the vaccination efforts, because the stakes are pretty high. There's a lot of optimism that this will be it, that this will be the solution to all of 2020's problems right now. I do wonder, though, how soon can we actually feel the effects of the vaccines when it comes to lowering the infection rate, given that we really don't have more information about whether even the shots will be able to prevent transmission?
Yes, so the good news is we have vaccines that have a very high level of efficacy, greater than 90%. That's about as good as a vaccine can get. And history has shown that when you introduce a very highly effective vaccine into the population, it can dramatically reduce and eventually eliminate that infectious disease. So I guess the first question you had is, how long is it going to take us to get to, a safer place where, we can go back to life as normal? And that really depends on how quickly we can get the vaccine to achieve herd immunity in the population with these vaccines. And that's really going to depend on a lot of variables. We've been very successful in developing highly effective vaccines, but now the next thing we have to look to is distribution and getting enough people to take the vaccine. So if we didn't have a vaccine, the estimates are that we could have this pandemic until 2025 before we actually. But with the introduction of a vaccine, it depends on how many people will take it. If we can get, right now, say 40% of the people might take it, maybe we'll get back to normal by next year this time. But the hope is that we're going to get closer to 60% of the people will take it. And if, prediction is that, the majority of people have access to the vaccines by, say, April. And if that were to happen, then we might see things get back to normal as early as May, if you get more than 70% of the people taking it, or July or August, if you get 60% of the people taking it. So it really depends on us, on how quickly we want to get back to normal.
Professor, it does also depend to some degree on the virus as well, because we've heard news from the UK of a new strain which is 70% more infectious. What do we know about this, and does it affect vaccine efficacy?
Yeah, that's a very important point. All of that prediction depends on the fact that the virus doesn't undergo a mutation that would allow it to evade vaccine-induced immunity. And so what we do know is that, first of all, viruses mutate all the time. We know this. And in particular, RNA viruses like SARS-CoV will undergo mutations or replicate themselves. And every time they do, they will introduce mutations. Now, the majority of those new variants actually just die out, so we never see them. But now and then you'll get a mutation, and that could create a different property in the virus. In this case, what they're reporting is that they're seeing a new mutant that appears to have gained greater transmission capability. And so that is a concern. And so the next question that we need to ask is, does that then new virus, does it increase pathogenicity or severe disease? And so far, they don't have any evidence that that has caused an uptick in severe cases or hospitalizations. So they don't think this new virus is actually causing increased severity and disease. And then the next question is, would this virus be able to evade the vaccine-induced immunity? And they are testing that right now. But based on the mutations we've seen so far, the expectation is that this mutation should not impact the ability of these vaccines to protect against it. It's important to know we have seen other mutations emerge. And we have a number of different mutations that have come up with this particular coronavirus. And for all of these vaccines, they've tested them against these new variants. And to date, we haven't found any variant that has been able to evade the vaccine.
That's very encouraging. What's next in the vaccine front? Because we have Pfizer, we have Moderna now. Who is next, and how soon could we get there?
Right. So the first two vaccines are the RNA vaccines, and that's really of no surprise since they're the quickest actually to design and produce. The next generation or next wave of vaccines, I should say, are going to be the adenovirus-based vaccines, the ones from AstraZeneca and J&J. And these two particular vaccines are very close to completing phase 3 clinical trials, and will likely be looking to get emergency use authorization. I think it's really important that we have as many vaccines, effective vaccines out there as possible. Based on the data we've seen from phase 2 trials of all of these vaccines, they all look really promising. They're inducing really good immune responses, and the expectation is that efficacy should be pretty high with all of these vaccines. The more vaccines that we have out there, the quicker we can get to that 60% of the people getting a vaccine and getting to the level of herd immunity so we can get life back to normal.
The speed of this work has been quite breathtaking, and some of the research has been groundbreaking as well. What are the implications of the research that's been done for preventing and avoiding future pandemics?
I think this is a really important point. All of these particular vaccine platforms have actually been in development for over 30 years with an eye toward eventually becoming the vaccines of choice for rapid response to future pandemics. They were at the cusp, really, of becoming, more commonplace when COVID-19 came out. And so that just helped accelerate their development. And so the impression we get is that these were just suddenly invented, but they've been really around for a while, at least in our laboratories. And we had a lot of knowledge about how they would function and how they could be very useful in a pandemic. One of the things I want to point out that's really important is that we talked a little bit about potentially new mutants of virus coming up, and eventually maybe one could emerge that could evade the immunity induced by our vaccines. But all of these particular types of vaccines, what they are, what we call plug-and-play vaccines. They rapidly can be updated to meet any new emerging virus that might come out. So, we've gotten used to every year we get the influenza vaccine, but that vaccine, it takes a long time to update it. With these types of vaccines, say if a new emerging virus comes out, it would really take only weeks to update it and manufacture a new one to match the new emerging virus.
Professor, as we see December shaping up to become America's worst month so far from the pandemic, what should the public be aware of as we await those vaccine doses to be available to all of us?
I think the public really needs to be aware that there is a light at the end of the tunnel, but in the interim, we really need to continue to maintain our diligence in social distancing and masking and all of the non-medical strategies to slow and reduce the transmission. With more transmission, we can actually see more virus mutations as well. So the light at the end of the tunnel is coming, but it's going to take time because these vaccines are going to be rolled out sequentially. And, as I mentioned, it could be months before we can get to the point that life could be, back to normal again. And even after you take a vaccine, it's really important that you continue to wear your mask and social distance to protect those, to maintain protection among those who haven't had a chance to get the vaccine yet.